Yeah, the comparing team. Yes, you can take over.
So, the first scientific session of the Physiology of Stress by Dr. Priscilla Catherine Ma'am, who is Professor and Head of Department of Physiology, Government Tiruvannamalai Medical College. I kindly request Dr. Bharadirani Ma'am, Associate Professor and HOD of Department of Anatomy, and Dr. Sudha Ma'am, Associate Professor of Department of Physiology, Madurai Medical College, to chair the session and introduce the speaker.
So very good morning to one and all here. So it's my pleasure to introduce the speaker, who is very close friend of me for nearly 30 years. Okay. So she is Dr. Priscilla Catherine, Professor and HOD of Government Tiruvannamalai Medical College. She has done her undergraduation in PhD Medical College, and she has done diploma in ophthalmology also. The MD from Tanjavur Medical College. She's a PhD holder from Tamil Nadu Dr. MGR Medical University. So she's the resource person for research methodology that is conducted by Dr. MGR Medical University, and she is also a convener for medical education unit. She has more than 10 publications in national and international journals. So over to you, ma'am.
Thank you, Dr. Sudha, my close friend, for the nice introduction. First of all, I would like to thank Dr. Muthuselvi ma'am for giving me this opportunity of visiting Sivaganga Medical College once again. This place is very close to me. I have very good memories of this place. And I'm happy to meet Professor Tamil Kodi ma'am, my previous other department colleagues, Dr. Bharati Rani ma'am, and my very close friend Sudha ma'am here, and all the other people who I have known here. Thank you for this opportunity, ma'am. Shall we start the session? I think ma'am has chosen a very apt topic for today's times, stress for mental health. So this session is going to be on physiology of stress. Ready? Start பண்ணலாமா? Okay. So this session is on physiology of stress. The other sessions will be a continuation of physiology, psychology, and other complications of stress. At the end of this session, you'll all be able to define what is stress, okay? And then you'll be able to tell what are the types of stress and what is the stress response. This is an important part of your CNS topic. So at the end of this class, you would have already heard something about this topic in your school. You'll be touching on that and getting to know some more points. and you'll be knowing what is HPA axis and about the role of autonomic nervous system in stress and what are the deleterious effects of stress, what is the physiological basis of that. Okay? So what is stress? What name is given here? Hans Selye. Whenever anybody talks of stress, even ma'am has written a quote here. The first name that comes into play is Hans Selye. Do you know of another physiologist, Walter B. Cannon? What is he famous for? Unga first chapter in physiology. What is he famous for? Homeostasis. Okay. He also studied so much on stress related to homeostasis. Then Hans Selye came and he talked about what is called general adaptation syndrome for stress. So whenever we talk of stress, we'll be talking of GAS or general adaptation syndrome. So he defines stress as, we'll be talking of stress in terms of physical or mental aspect. Usually stress la irukena innoru term enna use பண்ணுவோம், tension ah iruken, stress ah iruken, like that. What he defined is, stress is any internal or external threat to our homeostasis. The entire organ system's aim is to maintain homeostasis, all the organ systems. So anything that is going to disturb that is said to cause stress, and the stress response is trying to overcome that. Is that clear? So it is actually, stress is a response. It is not just the threat. It is the entire response which is physical or psychological threat response. For that, the body is going to respond in a holistic manner. What is the purpose? We have to overcome that threat and continue living in a healthy manner. So the aim of the stress response is to bring our body back to homeostasis. Sometimes that will be successful, sometimes that might not be successful. So what is a stressor? உங்களுக்கு தெரிஞ்சு எதை ஸ்ட்ரெஸ்ன்னு சொல்லுவீங்க? Anything? It can be a group answer or an individual answer. What will you consider as a stress? கேக்கல, exam, IA. என்ன? Exams. Anything else? Any other threat? Friends? Any other threat? Which do you consider as a threat or a stressor? ஏதா ஒரு physical example சொல்லுங்க. IA is a psychological threat. Exams are psychological or emotional threats. Physical threats? Morning. Okay. Physical threat? An injury, trauma, accident, fever, all that are threats. Okay. So a stressor can be internal or it can be an external threat. It need not be just from the outside. It can be from inside your body itself. Another thing we have to remember is, stress might be something which is real, which is actually existing. Sometimes the threat might not exist. It might just exist in our imagination. Anything we perceive to be a threat can elicit a stress response. Even a imaginary situation. Sometimes you might imagine that the exam is going to be very difficult. That will make you stressful, but actually it might not be very difficult. It also depends on how you are prepared for the exam. So stressors are not something which are finite. It can be real, it can be imaginary, it can be from within your body or it can be from outside. So we have to understand that stressor is not something which is fixed. So it can be a real or an imagined threat. Okay? இந்த என்ன பழமொழி போட்டிருக்கு? பாம்பை கண்டால் படையும் நடுங்கும். So what is a stressor is determined by our previous experience. We all know that snake is dangerous. So we are automatically afraid of snake. We perceive as a threat. But does everybody do that? That same threat, if we are ignorant, a child might not know that this is a threat. So psychological threats are determined by our previous experience and also by our personality. What is this movie? மேலே இருக்கிறது என்ன படம்? தென்னாலி. தென்னாலியில் கமல் என்ன பண்ணுவான்? எதை பார்த்தாலும் பயம். So his personality makes him perceive everything as threat that is going to affect his well-being. Whereas வடிவேல் என்ன டயலாக் எப்போ சொல்வார்? risk எடுக்கிறது risk. So it depends on whatever you feel as a threat might be a casual thing for another person. We have to understand that to understand physical and mental responses or psychological responses to threat. So now, what are the types of stressors? Already we have discussed about physical stressors. Can you enumerate some other physical stressor? Is exercise a stress? Yes or no? Exercise is a stress. Exercise, even thinking of exercise can elicit adjusting stress responses in our body, and the actual exercise itself is a threat for our body. And psychological stress, already we have discussed, emotional stress and even fear. Which part of the brain is affected by these emotions? Which part of the brain mainly? Have you heard of limbic system? Limbic system கேள்விப்பட்டிருக்கீங்களா? That is the place where fear response is modulated or it is perceived. So if your limbic system fear center or fear response is very, very active, that person is going to perceive stress in a higher manner. Is that clear? So it plays a very, very important role in perceiving emotional stress. Then we should not think of stress something as only physical and psychological. Even environmental stressors. If you are sitting in a very hot room now instead of a air conditioned room, that itself is a physical stress. Each and every cell and blood vessel in our body is undergoing stress because it is moving in the circulation. Physics la நிறைய இடத்துல நீங்க பயோபிசிக்ஸ்ல பாத்தீங்கன்னா shear stress னு ஒன்னு படிப்பீங்க. So everything is a physical stress in our body, and we have mechanical stresses. When you walk, when you jump, everything is giving stress to the bones. So that is also serving a purpose, okay? And we have metabolic stresses, mitochondrial stresses. There are so many stresses. Since this topic is mainly on mental health, we'll try to restrict ourselves to psychological and physical stresses. So another way of classifying stress is acute, episodic and chronic. What do we mean by acute? Any stress which just lasts for a very short while. For example, you have one competition to attend. You have to come and talk in that competition. That might be an acute psychological stress. Or there is a single fall event. That might be a single stress. The person might come out of that stress easily. What is episodic stress? உங்களோட எக்ஸாம்பிளே சொல்லுங்க. IA. Again and again that stress is, and imagine you have IA every alternate day. That is going to be an episodic stress for you. Chronic stresses, the stressor is not removed. So it keeps on activating the stress response. Based on our reserve to overcome the stress, the body might successfully overcome it, or the person might succumb to it or succumb to some diseases because of the stress. Are you with me till now? Yes. So what are the types of stress? Active, episodic and chronic. What are the types of stressors? Physical, psychological. Broadly physical, psychological. Other stressors can be வேற என்ன பார்த்தோம் முந்தினதுல? Environmental, then mechanical, all type of stressors. And remember, stress can be from within, can be from without. Stress can be real, stress can be imaginary. Anything can elicit this stress response, okay? Now coming to the most important question. இவ்ளோ stress in CM ila வைக்கிறோம். Stress good ah bad ah? Good ah bad ah? Some stress are good, some stress are bad. Can you give an example for good stress? During examination? Okay, very good. So if you have little amount of stress, you will be studying better. Faster படிப்போம். And the stress response will help us to do our work in an energetic manner. But if that stress crosses a limit, that exam stress is going to become bad stress. Any other example of good stress? Exercise, okay. Within physiological limits, it is a good stress for the body. Then emotional good stress. Falling in love. Emotional bad stress, a divorce or something like that, okay? So stressors can vary based on the intensity. It can be good, it can be purely bad, and the response the body gives depends on what type of stress is it. Is it clear? Now, do you know what is the name for good stress? Anybody you have heard? Eustress, very good. CME எடுக்க வேண்டாம்னு நினைக்கிறேன். Eustress is good stress. And we have another type of stress called, what is the opposite? Distress, very good. We'll come to another one new term in the end. Who's this person? Sunita Williams. இது எந்த ஃபோட்டோ? எப்போ எடுத்த ஃபோட்டோ இது? அவங்க லேண்ட் பண்ண அப்புறம் ஆஃப்டர் மெனி மந்த்ஸ் அவங்கள எதில் உட்கார வச்சுருக்காங்க? I think they took her in a wheelchair or some stretcher. Why? Because அவங்களுக்கு ஸ்ட்ரெஸ் இல்லை. என்ன ஸ்ட்ரெஸ் இல்லை அங்கே ஸ்பேஸில்? கிராவிட்டியோட மெக்கானிக்கல் ஸ்ட்ரெஸ் போனில் இல்லை. ஸோ ஆப்சன்ஸ் ஆஃப் ஸ்ட்ரெஸ் கேன் ஆல்சோ பி bad. Okay, her muscle strength, everything was affected. So we cannot just say stress is bad. Stress can be good within certain limits and certain types of stress. Okay, so the term are eustress and distress. Eustress is good stress, distress is bad stress. Okay, now இது good stress ஆ bad stress ஆ? இது என்ன ஃபோட்டோ? என்ன ஃபோட்டோ இது? என்ன படம்? பார்த்துருக்கீங்களா? ஒரு கொலோசியமில் நடக்குது. ஐ திங்க் த ஹீரோஸ் ரசல் க்ரோ. somebody answered. Gladiator, part 1. He is fighting an animal. He is fighting for his life. Either he has to win the animal, he might get some injuries, or he is going to die. What stress? அவர் எவ்வளோ பெரிய ஹீரோவாக வேணாலும் இருக்கட்டும், இஸ் ஃபைட்டிங் ஃபார் ஹிஸ் லைஃப். இந்த இடத்துல யூ ஸ்ட்ரெஸ் இருக்குமா, டிஸ்ட்ரெஸ் இருக்குமா? டிஸ்ட்ரெஸ் தான். பட் தட் ஸ்ட்ரெஸ் இஸ் ஹெல்பிங் ஹிம் டு ஃபைட். ஓகே, பட் திஸ் த ஷார்ட். ஏன்னா இது க்ரானிக்காக ஒரு டெய்லி அனிமல் ஃபைட் பண்ணால் இட்ஸ் கோயிங் டு பி டிஸ்ட்ரெஸ். நவ் வில் கம் டு அனதர் பிக்சர். இது யாரு? நல்ல இவர் என்ன பண்ணுறாரு? கார் ரேஸ். இவருக்கு மோஸ்ட்லி இப்போ என்ன ஸ்ட்ரெஸ் இருக்கும்னு நினைக்கிறீங்க? If he is enjoying it, he will be having euphoria. He might be enjoying the stress. That might be eustress for him. Okay, now உங்க ஒய்ஃப்க்கு என்ன ஸ்ட்ரெஸ் இருக்கும்? இவர் காம்படிஷன் போகிறப்ப கார் பல்ட்டி அடிக்குதுலாம் நியூஸ் வருதுல்ல. So the same stress might be different for different people. Okay, so now coming to physiology. இப்போ physiology டாபிக்னால ஸ்ட்ரெஸ்னா என்னன்னு தெரியும், ஸ்ட்ரெஸ் என்ன பண்ண போகுதுன்னு நம்ம பார்க்கணும். தென் only we will know how we can manage stress. ஸோ மெயினாக ஸ்ட்ரெஸ்ஸோட பர்பஸ் இஸ் you are going to face some threat. ஸோ த்ரெட்டை ஓவர் கம் பண்ணுறதுக்கு நமக்கு என்ன வேணும்? we need energy. ஸோ body has to do something to mobilize energy from somewhere, from the store, and it has to distribute that energy wherever it is needed. யூஸ்வலாக ஒரு த்ரெட் வந்ததுன்னா what will we try to do? We'll try to remove that threat, or we'll try to run away from that threat. So we need energy for that. For running away we need energy. So basically our brain is tuned to that running away from threat or fighting that threat. So for that, and the process ku ennala venona, main is your central nervous system. Especially your threat is perceived by enna part nu pathom? Limbic system, your hypothalamus, amygdala, all that. Okay, then two mains your endocrine system. CNS la what are the two main pool படிச்சது? brain and spinal cord. வேற system னு பிரிக்கிறோம்னா autonomic nervous system and your other central nervous system. So here which nervous system do you think is going to play a main role? Your autonomic nervous system. What are the two components of autonomic nervous system? Sympathetic and parasympathetic. அதில் எது மெயினாக வேலை செய்யும்னு நினைக்கிறீங்க? Sympathetic nervous system. Okay, so your autonomic nervous system, your endocrine system, and your immune system, all these are going to play a role in managing stress in a coordinated manner. Continue பண்ணலாமா? Okay, now coming back to Hans Selye, he told that whenever somebody faces threat, the body follows a pattern. He called that as general adaptation syndrome. Stress in vandirchina, he said there are 3 stages for stress. Any idea about that? CNS start பண்ணல. Okay, so the first stage is alarm reaction. So anybody who faces threat will first have alarm reaction. The 3 phases, the duration might be different based on the type of stressor and on the person. So first is alarm reaction, that is called as fight or flight response. So either you will stand and fight that threat, either physical, internal or external, or you will try to run away from that threat or escape that threat. Okay, so what is this reaction called as? alarm reaction or fight or flight response. Suppose that threat is continuing. Imagine you have some pain in your body due to injury. Initially, the body will go through this alarm reaction. If that pain subsides, if that injury subsides, the body will recover. But suppose that injury is going to stay for some time, that pain is going to stay for some time, the body will go to the next stage. What is the next stage? The body adapts to that stress. That is called as adaptation or resistance. What is the second stage? Stage of adaptation or resistance. Suppose this threat becomes chronic. Okay? The body, after one stage, all the adjustment responses, homeostatic mechanisms might fail. The body will succumb to that stress. What is that called as? Stage of exhaustion. All the adaptive mechanisms might not help the person to survive, or the person might develop some disease. The homeostasis might become dysregulated. So that is called stage of exhaustion, or that threat might succeed. So initially we have seen that you have neural response, you have autonomic nervous system response. All the responses will come into play. The body will be able to fight threat energetically. So we'll see how these mechanisms help us. Okay. So what is the main mechanism? Sympatho. What is the axis? We have two axes here. You have to, if they ask you about stress, you have to write two axes. One is HPA axis. Unga school le padichirpinga. What is HPA axis? Hypothalamo, pituitary, adrenal axis. Hypothalamo, pituitary, adrenal axis. What is that? This is a part of your endocrine and brain combined. You have other axis is also like that. What is the other axis? Sympathetico, adrenal, again medullary axis. We will see how these help us to fight stress. Okay. So what is this axis? Is this HPA or sympathetico adrenal medullary axis? This is your sympathetico adrenal medullary axis. What you see on the right side is your sympathetic axis. Your sympathetic trunk is very, very important in fighting fight or flight response, in helping in that. What are the hormones which are secreted when you feel you're tensed or you are running some exercise? Have you heard of adrenaline? என்னன்னு சொல்லுவோம் அந்த ரெஸ்பான்ஸ்க்கு? அட்ரினலின் ரஷ்ன்னு சொல்லுவோம். ஸோ whenever there is sudden severe threat, your sympathetic system is going to discharge on its own. லிம்பிக் சிஸ்டம்க்கு இது ஒரு த்ரெட்டுன்னு தெரிஞ்சிடும். இமீடியட்டாக சிம்பத்தட்டிக் சிஸ்டம்லேருந்து you will have mass discharge of adrenaline. This adrenaline will be coming through your sympathetic ganglion stimulation. We have sympathetic ganglion, acetylcholine will stimulate that. ஒரு organ-க்கும் வேறு வேறு receptors இருக்கும். We will not go into that. Finally, mainly what is going to get stimulated from your sympathetic ganglion? Norepinephrine. Okay, what is the other name for norepinephrine? Noradrenaline. Now the same sympathetic stimulation, it can also influence your adrenal gland. Adrenal medulla. School la padichirkingala, adrenal medulla can again secrete adrenaline, noradrenaline, but the main secretion here will be adrenaline. Okay. இது ரெண்டுக்கும் என்ன டிஃபரன்ஸ்னா, sympathetic response will be within seconds or milliseconds, whereas இது adrenalக்கு வந்து அங்கேருந்து secrete பண்ணுறது, this is little intermediate response. So body immediately sympathetic system வழியா it will get a rush for you, adrenaline rush or a mass discharge of noradrenaline. That is your immediate response. Through the adrenal it is going to give a little intermediate response. இன்னும் கொஞ்ச நேரம் it will help you to do. So what is it going to help you? What do you want to do? Energy redistribute பண்ணோன்னு சொன்னோம். எதுக்கு எனர்ஜி வேணும் ஓடணும்னா? Which system needs energy more? Your muscles need energy. You have to run. So your muscles are going to have increased blood supply. So the other organs are going to have decreased blood supply. Heartக்கு blood வேணுமா வேண்டாமா ஓடுறதுக்கு? You need more blood supply if the heart has to pump blood to the skeletal system. So your GIT does not need that much blood supply. Your kidney maybe for a short term it does not need that much blood supply. You should not want to go to the restroom when you want to run away from a tiger. So you can remember that whichever system you don't need energy temporarily, angela vasoconstriction nadakum. The other systems will have vasodilatation. That is what your adrenaline and noradrenaline is going to do. Okay. This picture is from your textbooks only. It shows what adrenaline, noradrenaline does to increase energy supply. Energy வேணும்னா என்ன நடக்கணும்? You have to break down glycogen. You have to form new glucose, gluconeogenesis. Heart la you need more cardiac output, adukku nadakum. Sympathetic activation, skeletal muscles la it will cause vasodilatation so that your muscles can work better. All that is given in this picture, okay? So whatever adrenaline or adrenaline does, that will happen in the stress response. Now இன்னொரு axis என்ன இருக்குன்னு படிச்சோம்? இன்னொரு main axis என்ன stressனாலே HPA axis. What is H? Hypothalamus. What is P? Pituitary and your adrenal. Inga adrenal medulla, there adrenal cortex, okay? So from the hypothalamus, we have through the portal system, it is going to influence your pituitary. What is CRH? இன்னும் endocrine வரல இல்ல ஸ்கூல்ல படிச்சிருப்பீங்க. endocrine. So CRH is
உங்களுக்கு தண்ணி வேணும்னா அதுல இருந்து எடுத்துக்கோங்க. அந்த வெளியில இருக்கு அதுல இருந்து எடுத்து பண்ணிக்கோங்க. உள்ள அவங்களுக்கு
இந்த கேன் இருக்கு இங்க.
அவங்களுக்கு உள்ள இருக்கிறவங்க
அங்க கேன் கொடுத்துருக்காங்க. சேர்ல இருக்கு.
வேணும்னா அவங்க எடுத்துக்க சொல்லிருங்க.
சரி.
இது போயிட்டு தானே இருக்கு.
போயிட்டு. சரியா நிமித்திருக்கா நிமிந்திருக்கா எங்க வருது ஆடியோ இப்போ இந்த ஆடியோ வருதா இல்லையா?
cortisol அதிகமாயிடுச்சு. feedback வந்து again your cortisol level. acute stress la this can happen, but chronic stress la what will happen is this cortisol level will keep being in a high level and that is going to cause complication. Anything which is in excess is going to cause complication even though it is good. Cortisol is good to handle stress. It does so many things for energy mobilization, to prevent or inflammation or to decrease inflammation. It will do so many things, but still அதுவே நிறைய ஆயிடுச்சுன்னா the body is going to suffer. அது எப்படி நடக்குது? Already we have seen there is a feedback. So எப்படியும் stress வந்தாலும் திருப்பி stress வந்தாலும் cortisol level negative feedback la it has to come back la. Why does it stay in a raised manner? Here we have a single point. ரொம்ப சின்னதா இருக்குன்னு நினைக்கிறேன். What is set point? Your body homeostatic mechanisms, everything has a set point. Your glucose level, BP, even your cortisol level has a set point. But what happens in chronic stress is in the set point alter ஆயிடும். Central cortisol itself becomes raised. So cortisol level will stay in a raised manner during the stage of adaptation, resistance at all. Whenever it is raised, it is going to cause problems. It will help in healing, but finally அதனால தான் திருப்பி stress வந்துட்டே இருந்தா we should try to move away from that or try to remove that stress. Cortisol, even though it is helpful, when in excess it is going to affect our body in so many means. Is that clear? So it is going to break this feedback. This feedback is going to become dysregulated because set point மேல போய்டும். Is that clear? So அவங்களுக்கு bloodல பார்த்தா cortisol எப்படி இருக்கும்? Raised இருக்கும், strained, stressல இருக்கும் உங்களுக்கு. Okay? So இது வரைக்கும் ரெண்டு axis பார்த்திருக்கோம். So what are the different stress hormones? இது வரைக்கும் நம்ம பார்த்தது first is CRH, corticotrophin releasing hormone. Your limbic system இது வழியா தான் வேலை பண்ண போகுது. Next, what is the next hormone? ACTH, then cortisol. This is the main hormone. Glucocorticoid, cortisol. You have mineralocorticoids. Even your growth hormone plays a role in stress response. Your thyroid hormone, we saw that இங்கெல்லாம் வந்து negative feedback, but thyroid hormone கூட sometimes அதோட level குறையும் stressல. That has been shown. In some types it increases, okay? And ADH also plays a role in stress response. Is that clear? If they ask you about stress, will you be able to enumerate the main hormones? There are so many other things, but these are the main things. Yes or no? Now, இந்த ஹார்மோன்லாம் நார்மலாக நம்ம பாடியில் 24 hours யூனிஃபார்மாக செக்ரீட் ஆகுமா இல்லை வேரி ஆகுமா? வேரிஸ். விச் சிஸ்டம் in the brain controls that variation? What is circadian rhythm? Circadian rhythm is linked to the outside light cycle. The 24 hours light cycle. Hypothalamusly you have what is called SCN nucleus. That is going to maintain this circadian rhythm. In addition, there is pulsatile secretion of these hormones. See, you can see that your stress hormone, even in a normal person, your ACTH stress hormone, it is more in the early morning or during deep sleep. That is why we say sleep is important for overcoming or having the ability to manage stress. If your sleep is affected, the baseline cortisol secretion itself will be affected. If you keep sleeping late because you are watching your phone or something, so that is going to decrease your capacity to handle stress. All your cortisol secretion is going to go out of sync. Is that clear? Even ACTH has pulsatile secretion. So, இன்னொரு important point, suppose you are going to measure the cortisol level. ஒரு patient stress இருக்கா இல்லையான்னு பார்க்க போறோம்னா, we have to remember that the level of cortisol will vary based on the daytime where you are taking the blood, when you are taking the blood. So, அதை வச்சு நம்ம report interpret பண்ணோம். Is that clear about the hormones? Okay. Now, this slide is about what are the different functions of cortisol during a stress response. In a normal person, the cortisol might have slightly different functions. But during stress response, when it is working alongside your catecholamines, the response or the actions might be little different as according to need. So, main-ஆ நமக்கு என்ன செய்யணும்? Blood glucose level என்ன பண்ணணும்? It has to increase because you need energy to fight the stress. So, what will happen to glycogen? Glycogen will be broken down. What will happen to new amino acid formation? Increase ஆகுமா, decrease ஆகுமா? Amino acids will be formed because you need again gluconeogenesis will happen. That amino acid can be used for energy. Then what will happen to fatty acids? Energy can be got from fatty acids also. So all these can happen, and we have what is called insulin glucagon ratio. Insulin அதிகமாக இருந்ததுன்னா glucose level என்ன ஆகிடும்? கம்மியாயிடும். So இந்த cortisol level கூடுறப்ப your insulin glucagon ratio will decrease. Whereas in a normal person, cortisol might have different functions on the insulin glucagon ratio. So overall, what is the aim? To increase energy supply and to redistribute energy supply. அது ஞாபகம் இருந்ததுன்னா you can write. And another thing is, we saw that is going to break down proteins. But we have stable proteins and labile protein. In the cortisol initially, the labile protein மட்டும்தான் mobilize பண்ணும். ரொம்ப chronic stress இருந்தால் it is going to affect your actin, myosin, all that. Initially, it will be using only the labile proteins from the stores. Is that clear? So, what is the first and foremost hormone for managing stress? Cortisol, cortisol, cortisol. Kuda adrenaline and noradrenaline. Okay? So, now, இவ்வளோ தூரம் stress, good, bad எல்லாம் படிச்சிட்டோம். Coming to the bad. Which part of the body is affected by stress? ஒன்னா எல்லாமா? எல்லா பார்ட்டும் affect ஆகும். Okay? For example, we'll start with reproduction. What happened during COVID? COVID time, நிறைய இன்ஃபர்ட்கவங்க எல்லாரும் கன்சீவ் ஆனாங்க. Especially those in software. Actually, people said that proves that stress is a cause for infertility. Okay? Both in men and women, it can decrease spermatogenesis, it can affect your FSH, LH secretion. Everything can be affected by stress itself, and it can even cause infertility, impotence, erectile dysfunction because of stress. So, removing stress will improve the reproductive health or at least decreasing stress. So, we should know that even the reproductive system, நம்ம heart தான் affect ஆகுது, அந்த மாதிரி நினச்சிட்டு இருப்போம். Brain தான் affect ஆகுது, mental stressனு. Even your reproductive system can be affected. GIT affect ஆகுமா? எக்ஸாம் முன்னால் எப்படி இருக்கும்? We'll have butterflies in stomach. நிறைய பேர் காலைல வாந்தி எடுப்பீங்க. You'll have acid secretion more, gastritis. So, your GIT is affected, your reproduction is affected. Heart என்ன ஆகும்? When you are stressed, you will have tachycardia. When the stress becomes chronic, your lipid metabolism is affected, atherosclerosis, heart attack, hypertension. So, all the organ systems are affected. Even your respiratory system is affected. Okay? உங்களோட டைடல் வால்யூம், bronchitis அதிகமாக வரும். எஸ்பெஷலி இம்யூனிட்டி அஃபெக்ட் ஆகிறனால ரெஸ்பிரேட்டரி சிஸ்டம்லேயும் கொஞ்சம் ஆக்ஷன்ஸ் இருக்கும். Musculoskeletal system, already we saw an example. We saw Sunita Williams. Only if you have good amount of stress, your bones will be and muscles will be functioning properly. அதுவே bad ஆயிடுச்சுன்னா your muscles can be affected. Patient joint pain இருக்குன்னு சொல்லுவாங்க, muscle weakness இருக்குன்னு சொல்லுவாங்க. All that can be caused by stress. Immunity is very, very important in stress. Okay, actually, who's this? Your mental health, cognition, அது ஒரு தனி டாபிக் we have. Psychological effects of stress, cognition, memory, everything is affected by stress. Who's that athlete there? Athlete or sports person? Cricket தவிர எதையும் பார்க்கறது இல்லை. இது என்ன கேம்? ஜிம்னாஸ்டிக்ஸ். லாஸ்ட் ஒலிம்பிக்ஸில் என்ன நடந்தது? This is Simone Biles. She is the topmost gymnast in the world. She went to the games, then she said, I am not participating. Stress is affecting my psychological well-being. So I am withdrawing from the game. She was prepared for the game. She had trained for the game. See how much stress can do to a person. So we should think about physical and mental well-being, which is affected by stress. It will affect our learning ability. ரொம்ப ஸ்ட்ரெஸ்ஸில் இருக்கோன்னா ஒரு blank out மாதிரி இருக்கும். We might not be able to read. Okay, we might not be able to remember things because hippocampus is also affected by stress. Memory encodingக்கு hippocampus வேணும். That will also be affected by stress. Okay, but actually ஒரு விதத்தில் hippocampus will help. Imagine you fall down in this step today without knowing it pains. Tomorrow that memory will help me to prevent that stress. But long term stress vandaduna hippocampus nama memory retaining capacity itself will be affected. So any part of the body can be affected by stress. That is why adutha session la they will teach you how to manage stress. Okay, now we said that stress and immunity, they are like a couple. Stress will affect immunity, immunity affect arapo stress will also be affected. Okay, cytokines play a very, very important role. What are the two types of immunity? Two main, cell mediated and humoral. இதில் எது அஃபெக்ட் ஆகும்னு நினைக்கிறீங்க? ரெண்டுமே அஃபெக்ட் ஆகும். செல் இம்யூனிட்டி அஃபெக்ட் ஆகிடும். சைட்டோகைன்ஸ், டிஃப்ரெண்ட் இன்டர்லியூக்கின்ஸ், ஒன் வில் இன்க்ரீஸ், ஒன் வில் டிக்ரீஸ். இம்யூனிட்டி இன்க்ரீஸ் ஆகுமா டிக்ரீஸ் ஆகுமா? வாட் டஸ் கார்டிசால் டூ? Whenever somebody has an inflammation or some severe illness, we give steroids. Cortisol is a steroid. What does it do to the inflammation? It decreases inflammation. So we know that, or somebody has undergone a transplant, to decrease inflammation and immunity, we give steroids. So on one side, cortisol is going to decrease immune response. Another side, chronic stress can increase immune reactivity, but in a wrong way. So the patient can develop stress. There is more chance for developing autoimmunity. There is more chance for developing malignancy also. Immunosuppression nala natural killer cell activity எல்லாம் போயிடுச்சுன்னா கேன்சர் செல்ஸை கண்டுபிடிக்க முடியாது. ஸோ ஸ்ட்ரெஸ்ஸில் இருக்கவங்களுக்கு மெலிக்னன்சி வர்றதுக்கும் சான்ஸ் இருக்குது. ஓகே, தட் இஸ் வை we have to minimize or learn to handle stress. And there is another thing, CRH, mast cell histamine axis. நிறைய பேர் டென்ஷன் ஆனதும் they have running nose, allergic symptoms எல்லாம் வரும். ஒரு கண்டிஷன் ரெஸ்பான்ஸ் மாதிரி வந்துடும், Pavlov's conditioning மாதிரி. That is because of the CRH, mast cell histamine axis. So stressல even histamine release, skin diseases can happen in stress. Patient might have more histamine release, allergy, angioedema, அது எல்லாமே வரும். So make sure that we have to decrease stress to make sure all organs are healthy. Now stress ன்னு சொல்கிறோம். As doctors, can we measure stress? Okay, what is given here? We might use scales to measure it. Psychologists might use some scale. அதில் நிறைய questions இருக்கும். You can do it yourself or somebody can help you do. It's a standardized scale. Example is perceived stress scale. If you get a score above something, we can tell that this person is under stress. Otherwise, what are the other mechanisms to measure stress or methods? One, physiologically சில டெஸ்ட் பண்ணலாம், பயோகெமிக்கலாக பண்ணலாம். பயோகெமிக்கல் ஆல்ரெடி we have discussed. என்னெல்லாம் மெஷர் பண்ணலாம்? Which are the stress hormones? Main is cortisol. You can measure cortisol. You can measure catecholamines. You can measure it in the serum. You can measure it in urine metabolites. பார்க்கலாம் catecholamine metabolites. Saliva measure பண்ணலாம் cortisol. Only thing is, remember, we have to see what time we are taking the measurement. அதை பொறுத்து நார்மல் வேல்யூ மாறும். Then We can measure the pupil size using some instrument which is continuously measuring pupil size, something attached. Pupil size என்ன ஆகும்னு நினைக்கிறீங்க sympathetic responseல? Dilate ஆகும் because we need to have a more view to run away. So pupil size measure பண்ணலாம். Eye movements, stressed இருக்கப்ப eye movements might be more, your respiration might be more. And in the lab we measure what is called HRV. HRV கேள்விப்பட்டிருக்கீங்களா? Heart rate variability. Normally we say our heartbeat is 72 or 80, but with every respiration our heartbeat is going to vary based on the activity of the sympathetic and parasympathetic system. Normally there should be variability. Variability மாறினாலும் it is abnormal. Okay, we have many factors or points in heart rate variability. Measurements இருக்கு. Sympathetic activity நிறையா இருந்தா அந்த value will be affected. Okay, if you know that much it's good. So how do we measure stress? First common என்ன யூஸ் பண்றோம்? non invasive we use scales. Usually psychologists அதான் யூஸ் பண்ணுவாங்க. If you go and tell I have stress, they might ask you to answer a questionnaire based on the report. Then you have lab test, you have physical and physiological measurements. Is that clear till this? Now we have come to the end of this session. Or few interesting things. Suppose somebody is in a war. He has lost a limb because of a bomb, but he has to continue running. Will he feel the pain? He might not feel the pain. Or that gladiator fight itself. He has to continue fighting. He might have got a big cut or an injury. So we have what is called stress-induced analgesia. Brain has the capacity to make us forget pain when we are in stress. That is actually a helpful mechanism. And by stress right from childhood, severe stress, it might be because of lack of nutrition or severe emotional stress, they might have dwarfism. That is called psychosocial dwarfism. Okay, and vasovagal syncope nu onnu irukku. இதுவும் ஸ்ட்ரெஸ்ல வரலாம். இல்லை நீங்கள் ஃபஸ்ட் இயர் டிசெக்ஷன் ஹாலில் நிற்கிறப்ப ஃபஸ்ட்டு கெடாவரை பார்த்ததோ இல்லை பிளட்டு ஃபஸ்ட்டு தியேட்டரில் பார்த்ததோ தொப்புன்னு கீழே விழுந்துருவாங்க மயங்கி. அதுவும் ஸ்ட்ரெஸ்ல வரலாம். பட் ஹியர் வி ஹாவ் டு ரிமெம்பர் தட் திஸ் இஸ் பிகாஸ் ஆஃப் parasympathetic ஓவர் ஆக்டிவிட்டி. parasympathetic system stressல stimulate ஆகி you have massive vasodilatation, hypotension, the patient falls down. Okay, so this is one thing related to that. And before going to the top one, what is hormesis, what is sus-stress? Sus-stress na it is sub-stress or sub-level of stress. நார்மலாக எல்லாருக்கும் ஒரு லெவல் ஸ்ட்ரெஸ் இருக்கணும்னு பார்த்தோம். பிகாஸ் ஸ்ட்ரெஸ் ஹேஸ் சம் பெனிஃபிட்ஸ். இஃப் சம்படி கம்மியாகவே ஸ்ட்ரெஸ்க்கு பழகிட்டாங்கன்னா தேர் ரிசர்வ் டு மேனேஜ் ஸ்ட்ரெஸ்ஸும் குறைஞ்சிரும். இப்போ அதுக்கு தான் எக்ஸசைஸ் பண்ணிகிட்டே இருந்தால் ஹார்ட்டில் கார்டியாக் ரிசர்வ் இம்ப்ரூவ் ஆகுதுன்னு சொல்கிறோம். ஸ்ட்ரெஸ்ஸே இல்லாமல் பழகிட்டு ஒரு சின்ன ஸ்ட்ரெஸ் கொடுத்தாலும் தே மைட் நாட் பி ஏபிள் டு மேனேஜ். ஸோ வாட் இஸ் சஸ் ஸ்ட்ரெஸ்? இட் இஸ் ஹேவிங் சப் ஆப்டிமல் ஸ்ட்ரெஸ், தட் இஸ் ஆல்சோ நாட் குட். ஹார்மெசிஸ் இஸ் எப்போவுமே ஒரு லோ லெவல் ஆஃப் ஸ்ட்ரெஸ் கொடுத்துட்டே இருந்தால் அவர் எபிலிட்டி டு மேனேஜ் ஸ்ட்ரெஸ் பிகம்ஸ் பெட்டர்னு சொல்கிறாங்க. ஆக்சுவலி ஃபாஸ்டிங் ஒரு மினிமல் லெவல் ஒரு லோ கேலரி இன்புட் அந்த மாதிரிலாம் கொடுத்தோன்னா ஆக்சுவலாக செல்லில் உள்ள ரெஸ்பான்ஸ் இஸ் பெட்டராக. லைஃப் இம்ப்ரூவ்ஸ் இஃப் தெர் இஸ் ஹார்மெசிஸ், லாங்கிவிட்டி இம்ப்ரூவ்ஸ். ஓகே, நவ் கம்மிங் டு த லாஸ்ட் ஒன், டொக்காட்சுபு சிண்ட்ரோம். கேள்விப்பட்டிருக்கீங்களா? மூவிஸ்லாம் நிறைய சொல்லுவாங்கள்ல, சம்படி ஹேஸ் லவ் ஃபெயிலியர், அப்படியே ஹிஸ் ஹார்ட் ஃபெயில்ட், என் ஹார்ட்டே போயிடுச்சு, செத்து போயிட்டான், இல்லை அவன் ஹார்ட் பிரேக்கில் இருக்கான், டோன்ட் கிவ் him any more stress. Is heart break real? This was first described in Japan. It has been found that heart break can be real for a short term. They might present with chest pain, எனக்கு நெஞ்சு வலிக்குது அப்படி சொல்லலாம். பட் ஆக்சுவலாக ஏஞ்சியோலாம் பண்ணால் அவங்களுக்கு they might not have any block in the heart. ECG changes கூட இருக்கும், ஆனால் ஏஞ்சியோலெல்லாம் பிளாக் இருக்காது. They have found that some part of the heart muscle might become weak, dilated, but this might come back to normal within a short time. So this heartbreak syndrome is called as Takotsubo syndrome. It's related to stress. So just as a tidbit, this has been included. So have you understood what we have discussed till now? Stress na எந்த scientist பேர் ஞாபகம் வரும்? Hans Selye. என்ன syndrome சொன்னாரு? General adaptation syndrome. என்ன 3 ஸ்டேஜ்? Alarm stage, adaptation or resistance, then exhaustion or recovery. Okay, exhaustion is bad, recovery is good. Now, what are the two axes which is involved? HPA and medullary axis. What are the main hormones involved? Cortisol, adrenaline, noradrenaline, your CRH, growth hormone, thyroid hormone, even your ADH, mineralocorticoids. Okay? And we have seen about some other terms. What is the other name for good stress? Bad stress? Distress. Okay? So we have come to the end of this session. How to manage stress will be dealt with by our next speakers in psychology of stress. Basis is, we should not worry about unnecessary things. We should plan our timetable better. Naane panna maten. My friend will be knowing. Hurry illama irukano and diet la curry kammiya irukano. Okay? Thank you for listening. Thank you so much.
Really a wonderful session by Priscilla ma'am. It's very happy experience for me to chair the session.
Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke. When your brain senses stress, it activates your autonomic nervous system. Through this network of nerve connections, your big brain communicates stress to your enteric or intestinal nervous system. Besides causing butterflies in your stomach, this brain-gut connection can disturb the natural rhythmic contractions that move food through your gut, leading to irritable bowel syndrome, and can increase your gut's sensitivity to acid, making you more likely to feel heartburn. Via the gut's nervous system, stress can also change the composition and function of your gut bacteria, which may affect your digestive and overall health. Speaking of digestion, does chronic stress affect your waistline? Well, yes. Cortisol can increase your appetite, It tells your body to replenish your energy stores with energy-dense foods and carbs, causing you to crave comfort foods. High levels of cortisol can also cause you to put on those extra calories as visceral or deep belly fat. This type of fat doesn't just make it harder to button your pants. It is an organ that actively releases hormones and immune system chemicals called cytokines that can increase your risk of developing chronic diseases such as heart disease and insulin resistance. Meanwhile, stress hormones affect immune cells in a variety of ways. Initially, they help prepare to fight invaders and heal after injury, but chronic stress can dampen the function of some immune cells, make you more susceptible to infections, and slow the rate you heal. Want to live a long life? You may have to curb your chronic stress. That's because it has even been associated with shortened telomeres, the shoelace tip ends of chromosomes that measure a cell's age. Telomeres cap chromosomes to allow DNA to get copied every time a cell divides without damaging the cell's genetic code. And they shorten with each cell division. When telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, when telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, chronic stress has even more ways it can sabotage your health, including acne, hair loss, sexual dysfunction, headaches, muscle tension, difficulty concentrating, fatigue, and irritability. So, what does all this mean for you? Your life will always be filled with stressful situations, but what matters to your brain and entire body is how you respond to that stress. If you can view those situations as challenges you can control and master, rather than as threats that are insurmountable, you will perform better in the short run. You will perform better in the short run and stay healthy in the long run.
MS instrumental music. ஏதாச்சும்
So we will resume after a short break. Enjoy your tea and snacks.
धड़कन तक तेनू रसता दिया सजना तू ता सारे दिल ते कब्जा करके बह गया अब नहीं कदी दिल दा यकीन कर पाएगी तू ता इश्क ही ठग बैठा सजना जा रांझड़ तू भी क्या याद रखेगा जाहिर ने तेनू छोड़ दिया जा रांझड़ तू भी क्या याद रखेगा जाहिर ने तेनू छोड़ दिया
Kindly everyone get inside and occupy your seats here.
வெல்கம் டான்ஸ். எஸ் அனுஷா ஸ்டார்ட்.
The greatest glory in life is not in never falling, but rising up every time we fall. These are words by Nelson Mandela. Respected dignitaries, esteemed faculty, dear colleagues and students, it's my pleasure to welcome you to this exciting medical education program on stress physiology. Now, let us get ready to groove to the rhythm and be mesmerized by the energy and passion of my friend who is here to present you the welcome dance.
गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
That was a spectacular dance, Alagalili. And with all these positive vibes, now I request the dignitaries to occupy their seats on the dais.
இதை தூக்கு ஏழு எட்டு போடுங்க பசங்க
Sound.
இரு நீங்கள் உட்காரட்டும். Dignitaries kindly occupy your seats and சொல்லலாம். பர்ஸ் எங்கே போச்சுன்னே தெரியல.
I kindly request the dignitaries to occupy their seats on the dais. Let us all rise up for Tamil Thai Valthu.
நீராறும் கடலுடுத்த நிலமடந்த எழிலொழுகும் சீராறும் வதனமென திகழ் பரத கண்டமிதில் தெக்கணமும் அது சிறந்த திராவிடனன் திருநாடும் தக்க சிறு பிறையுதரும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அணித்துலகும் இன்பமுற எத்திசையும் புகழ் மடந்த இழந்த பெரும் தமிழழகே தமிழடங்கே உன் சீரிலமை திறம் வியந்து செயல் பறந்து வாழ்த்ததுமே வாழ்த்ததுமே வாழ்த்ததுமே.
Thank you. Kindly be seated. Lighting a lamp during a ceremony symbolizes the triumph of knowledge over ignorance, hope over despair, and light over darkness, inviting positive energies and wisdom. Now, I invite the dignitaries to honor the ceremony by lighting the Kuttu Velakku. Thank you, ma'am. Please join me in welcoming our beloved HOD, Department of Physiology, Dr. Muthuselvi ma'am, who is the pillar of Physiology Department. She has a very dynamic, vibrant and charming personality with a kind heart. She has supported us and guided us a lot. Now she will address us with a welcome speech.
Respected Dean ma'am, VP ma'am, dignitaries on the dais and off the dais, and the most lovely part of this program is we have got the senior most physiologist of Tamil Nadu here, Dr. Tamilkodi ma'am, who is the pillar of physiology fraternity. So good morning to one and all, and hearty welcome to everyone present here. So first, என்னோட வணக்கங்கள் என்னோட பேரண்ட்ஸுக்கு. I am here because of them. So my sincere respects and love to my parents. And the secret of getting ahead is getting started. So we have got started. Very nice first session you all had on the physiology of stress. I think everyone should have enlightened about the physiology of stress. Now we are ready for the psychology and the stress relaxation techniques. And the most dreadful thing of later in our is the cancer. See, many எங்கே திரும்பினாலும் cancer occurrence அவ்வளோ increase ஆயிடுச்சு. அதனால தான் I chose a cancer specialist to give a talk on how the stress is related with cancer. So this is how we started. So we started this journey of Stringere as 2025 blooms. So last year we had a oath that every World Health Day will be a CMA day for physiology, Department of Physiology, Sivaganga. That is a decision we have made, and it is God's grace. This year also it is happening now, which is really, I'm happy for that. And heartfelt thanks to our Dean ma'am, VP ma'am, and everyone in the administration side who are very much supportive for us to do this program in a very wonderful manner. And really it was a wonderful journey with my beloved faculties and my dear students. Really they worked very hard for making this process a success. And Stringere in Greek means titan. Ma'am இன்னைக்கு காலையில் கேட்டாங்க என்கிட்ட ஸ்ட்ரிங்கர் தான் என்னமா அப்படின்னு டீன் மேம். ஸோ ஐ டோல்ட் ஹர் இஸ் டைட்டன். ஸோ டைட்டன் மீன்ஸ் ஸ்ட்ரெஸ். வாட் ஹேப்பன்ஸ் டூரிங் ஸ்ட்ரெஸ்ஃபுல் சுச்சுவேஷன்ஸ். எல்லா பக்கத்துலேருந்தும் ப்ரெஷர் வரும். அப்போ நமக்கே ஒரு டைட்டாக ஒரு ஃபீல், மூச்சு விடக்கூட முடியாத ஒரு ஃபீல். அது உங்களுக்கெல்லாம் இப்போ எங்களுக்கெல்லாம் உங்கள் வயசுலலாம் இல்லை நிஜமாவே. ஆனால் இப்போ நீங்கள் எப்படி இருக்கீங்கன்னு எனக்கு தெரியல. எவ்ரி ஒன் இஸ் ஃபீலிங் ஸோ ஸ்ட்ரெஸ்ஃபுல் ஃபார் ஈவன் பெட்டி ரீசன்ஸ். I don't know what why this change. ஸோ கேட்டால் என்ன சொல்லுவீங்க? ஜென்ரேஷன் கேப், பூமர், உங்களுக்கு ஒன்றும் புரியாது. இதுதான் எங்களுக்கு கிடைக்கிற பதில் இல்லையா? So that is the meaning of that Stringere. During stressful situations, really we are feeling so bad. இப்போ last ஒரு 15 days or so, our administration is also facing a very stressful situation. And every day, every other day paperல சிவகங்கை மெடிக்கல் காலேஜில் இது நடந்தது அது நடந்தது. See, the society is like that. Whatever good things happen, they won't reveal much. ஒரு சிம்பிள் பேட் திங் நடந்தா அதை இப்படி பூதாகரம் கண்ணாடி போட்டு காமிப்பாங்க. ஸோ திஸ் இஸ் த சொசைட்டி. பட் we are living in such a society. So we must learn how to face all these challenges in life. So that's what, keeping this in mind, I want to enlighten my students how to face stressful situation and what is a physiology. அதிலே நைஸாக நான் வந்து அகாடமிக்ஸையும் புகுத்திட்டேன். ஸோ அப்படி புகுத்தி சொல்லி கொடுத்தா மட்டும்தான் நமக்கு மண்டையில் ஏறும், அப்படி தானே? ஸோ தட்ஸ் வாட் ஐ ஃபெல்ட் அண்ட் it has happened and I am very happy for that. Even small kids இப்போது எதுக்கு எடுத்தாலும் டென்ஷனாக இருக்கு, என்ன டென்ஷன் பண்ணாத. வீட்டில் நாங்களாம் அந்த வேர்டை யூஸ் பண்ண மாதிரி எனக்கு ஞாபகமே இல்லை. ஆனால் இப்போ கிட்ஸ்லேருந்து ஆரம்பித்து ஈவன் ஆஃப்டர் ரிட்டையர்மெண்ட் லைஃப் வரைக்கும் அப்படியே தான் இருக்குது. பட் மார்னிங் ஐ ஹேட் த கிரேட் ஆப்பர்ச்சுனிட்டி ஆஃப் கம்மிங். மேடம் தமிழ்கொடி மேம் கேம் வித் மீ and I drove the car For 15 minutes, I had a very nice conversation with her. Madam, ஒரு 4 points எனக்கு சொல்லி கொடுத்தாங்க. நிதானம் தான் அதில் ஃபஸ்ட்டு பாயிண்ட். அதை வந்து அழகாக பிரிசில்லா சொன்னாங்க. நோ ஹரி. லாஸ்ட்டு ஸ்லைட் போட்டோன்னே மேம் சொன்னது தான் எனக்கு ஞாபகம் வந்தது. நோ ஹரி. நிதானம் இருந்தால் எல்லாமே செட்டில் ஆகிடும். ஸோ தட் நிதானம் வி ஷுட், அது நானுமே ஐ எம் வெரி புவர் இன் தட். ஐ எம் டெவலப்பிங் தட் அண்ட் ஐ எம் ப்ரவுட் தட் ஐ ஹவ் டெவலப்ட் பிகாஸ் ஆஃப் யோகா ப்ராக்டிசஸ். கண்டிப்பாக என்னால் அதை சொல்ல முடியும். ஸோ நிதானம் அது ரொம்ப முக்கியம். ஸோ தட் ஐ ஹேட் தட் ஆப்பர்ச்சுனிட்டி டு ஹாவ் her advice all through the way from Madurai to Sivaganga. So luckily, and I must welcome my dear speakers. See, really எப்படி இது God's happening நான் சொல்லுவேன். அருமையான 4 ஸ்பீக்கர்ஸ் எப்படி எனக்கு கிடைச்சாங்கன்னு ஐ எம் so happy. I am very thankful for the 4 speakers and welcome you all from my heart. So next is the great blessing, of course, the nod of acceptance from Tamilkodi ma'am. நான் கேட்டவுடனே ஒன்றுமே சொல்லலை. லாஸ்ட்டில் ஒரு கரூரில் ஒரு இதில் மீட் பண்ணோம், ஒரு சிஎம்இயில் மீட் பண்ணும்போது, அங்கே மீட் பண்ணும்போதும் மேம்கிட்ட கேட்குறேன் நான், மேம் எங்கள் சிஎம்இக்கு வர முடியுமா சீஃப் கெஸ்ட் ஆஃப் ஆனரா? உனக்கு இல்லாமல் யாருக்குடா அப்படின்னாங்க. அதனால் அந்த ஒரு அன்பு வந்து என்னை அப்படியே கட்டி போட்டுருச்சு. ஸோ நான் இங்கே கூப்பிட்றேன் அப்படின்ன உடனே கோமதி அவளோட டைரக்ட் ஸ்டூடெண்ட், மேடம் வர்றாங்களா அப்படின்னு ஷீ எக்ஸைட்டட் அண்ட் ஷீ ஜம்ப் லைக் எனிதிங். இந்த மாதிரி இன்றைக்கி காலையில் நான் பார்த்தேன் மேம்கிட்ட அத்தனை பேர் வந்து பேசிகிட்டு இருந்தாங்க. இங்கே நிறைய பேருக்கு மேமை தெரியுது. ஐ எம் நாட் ஹர் டைரக்ட் ஸ்டூடெண்ட். I have not worked with her, but I know her only as a physiologist. After I finished physiology, நான் சில இது கான்ஃபரன்சஸில் பார்த்து தான் எனக்கு தெரியும். ஸோ அந்த மாதிரி தான் மேம் எனக்கு பழக்கம். பட் இப்போது ஐ ஹவ் took the post of president of APT association. மேடமோட blessing அந்த ஒவ்வொரு நாளும் டெய்லி ஐ ஆம் கெட்டிங் மெசேஜஸ் ஃப்ரம் ஹர். ஒன்றும் இல்லை, ஜஸ்ட் ஒரு குட் மார்னிங் மெசேஜ் தான் மேம் போடுறாங்க டெய்லி எனக்கு. ஸோ இட் இஸ் நாட் அ வே, அவங்களுக்கு தேவையே இல்லை. பட் ஹவு இந்த ஏஜ்லேயும் ஷீ இஸ் அ செப்டுவாஜெனரியன். ஷீ இஸ் 79 now. will you believe? இன்னைக்கு காலையில் பார்த்துட்டு யார் சொன்னா, பாரதி ராணி டோல்ட், மேடம் அன்றைக்கி எப்படி பார்த்தேனோ அதே மாதிரி இருக்காங்க அப்படின்னு பாரதி ராணி. ஸோ ஆல் தீஸ் திங்ஸ் ரியலி ஹவ் மேட் CME a real blessed thing. Okay, and she is always a constant inspiration for total physiology fraternity. She only started, she was an initiative in starting the Association of Physiologists Tamil Nadu. காலையில் தான் அந்த கதையை சொன்னாங்க. ஏதோ ஒரு அகமதாபாத் போயிருக்கும்போது அங்கே உள்ள டெலிகேட்ஸ், அங்கே உள்ளவங்கெல்லாம் எங்களை ரொம்ப ஒரு மாதிரி லோவாக பார்த்தாங்க. தமிழ்நாட்டிலேருந்து இங்கே வந்திருக்கீங்களா, உங்களுக்கெல்லாம் எதுக்கு கான்ஃபரன்ஸுங்கிற மாதிரி ஒரு பார்வை அவங்ககிட்ட இருந்தது. அந்த பார்வைக்காக நான் ஆரம்பித்தேன். நாங்கள் இன்னைக்கு காலையில் ரியலி ஐ வாஸ் ஸோ, இந்த மாதிரி விஷயங்கள்லாம் நான் கேட்டு தெரிஞ்சுக்கிட்டேன் எனக்கு. அப்போது 2007 ஆரம்பித்தது தான் இந்த அசோசியேஷன். நவ் இட் ஹஸ் grown to so levels and now the members of APT are 700 in number from total Tamil Nadu, and really proud to announce this at this outset. So she is my mentor in all ways and means. Next thing, the most exciting and interesting part of this CME is the poster presentation competition. இது வந்து the idea was put forth by Dr. Kanchana, our associate. அவ தான் முதல்ல சொன்னாங்க என்கிட்ட, மேடம் நம்ம ஏன் இதை வந்து லாஸ்ட் டைம் we had concept maps competition வச்சோம். அது மேம் தான் ஜட்ஜ் பண்ணாங்க, டீன் மேமும் விபி மேமும். இந்த தடவை நம்ம ஏன் பண்ணக்கூடாதுன்னு ஒரு ஹியூஜ் டாஸ்க். ஸோ ஹவு டு மேக் ஸ்டூடெண்ட்ஸ் டூ ரிசர்ச், இட் இஸ் ரியலி, அது என்ன சொல்கிறது, ஒரு மிராக்கிள் மாதிரி தான். ஏன்னா ஃபேக்கல்ட்டி சைட்லே ரிசர்ச்சுங்கிறத நம்ம ரொம்ப உள்ளே போகலை, பர்டிகுலர்லி இன் கவர்மெண்ட் சைட். ப்ரைவேட் காலேஜஸில் இட் இஸ் அ மஸ்ட் ஃபார் தெம் டு டூ ரிசர்ச் அண்ட் ப்ரெசென்ட் பேப்பர்ஸ். அது இல்லாமல் அவங்களுக்கு சம்பளம் கிடையாது. நமக்கு அப்படிலாம் இல்லை, அதனால் நம்மளுக்கு மெனக்கிடுறதே இல்லை. ஸோ ஐ வாண்ட் த எய்ம் ஆஃப் திஸ் இஸ் டு மேக் எவ்ரி ஸ்டூடெண்ட், ஃபஸ்ட் இயர் ஸ்டூடெண்ட் டு நோ தட் there is a word called research. That's what. அது மட்டும் எனக்கு போதும். அது அச்சீவ் ஆகிடுச்சுன்னா யூ வில் கோ ஆன் யுவர் ஓன். ஸோ அந்த பேசிஸில் தான் திஸ் போஸ்டர் காம்படிஷன் வாஸ் டிசைன்ட் அண்ட் வி கேவ் டிவைடட் ஆல் தி 100 ஸ்டூடெண்ட்ஸ் ஆர் இன்வால்வ்ட். அது அதை விட இன்னொரு சந்தோஷமான விஷயம். லாஸ்ட் இயர் அதே மாதிரி தான் கான்செப்ட் மேப்ஸ், ஆல் தி 100 ஸ்டூடெண்ட்ஸ் ஐ இன்வால்வ்ட். ஸோ தே வர் டிவைடட் into 10 groups and each professor I gave 2 groups to address as a guide and they chose the topics by themselves. All the 10 organ systems were given. So this was the journey of this post competition and really a spectacular support from the faculties and the students. When beloved students, they really last pona varamla full and full they worked for this And great thanks for Department of Social and Preventive Medicine. Dr. Priya, Dr. Rajesh, Dr. Robinson, Dr. Indra, really நாங்கள் அவங்கள ரொம்ப நேக் பண்ணோம். எங்களுக்கு ஸ்டாட்டிஸ்டிக்ஸ் போட்டு கொடுங்க அப்படின்னு. ரியலி தே ஹெல்ப்ட் அ லாட் அண்ட் மை ஹார்ட்ஃபெல் தேங்க்ஸ் டு தெம் ஆல்சோ. அண்ட் kudos again to the students, and you have done spectacularly a great event. This had made this. So start by doing what's necessary, then do what is possible, and suddenly you are doing the impossible. Apdi da in the poster competition enakku irundhudu. Suddenly we came and suddenly we did the impossible thing. And many has appreciated, and thanks for Dr. Saravanan sir, who openly congratulate us in the at the end of first session that you have done the great thing, right? So once again I welcome you all on behalf of Department of Physiology to the CME and make it a grand success, and your presence is very much appreciated. Thank you one and all.
Thank you, ma'am. To the faculty, you are the heart of the institution. To the staff, you are the backbone. To the students, you are our purpose. We are honored to have with us today our Dean, Dr. K. Satyabama ma'am, who will be sharing a few words to open our event.
Respected Vice Principal, respected Medical Superintendent, respected Head of the Department of Physiology, respected RMO and ARMOs, and most respected our guest of honor, Dr. Malar Kodi, who was Dr. Tamil Kodi, who was former Dean, Government Kanyakumari Medical College. She retired as Dean, and before that she was Director of Department of Physiology at Madurai Medical College. Post-retirement, she has served as an honorary professor in various colleges, and continuing her academicship with the association. And I think it's a best moment the head of the Department of Physiology has done to us, our colleges, bringing in a very sportive person who will relieve all our stress by just looking at her. I would say she is 79 years young. And all the head of the department of various departments of our college and guest faculties, Dr. Ramu from Madurai Medical College to talk about the neurological aspects of stress, Dr. Malliga from Adyar Cancer Institute to talk about stress and cancer, and Dr. Priscilla, Head of the Department of Physiology from Thiruvannamalai Medical College, Physiology of Stress, and our own faculty who's got transferred, Dr. Asma Bacha, who is going to talk about the psychology of stress. And incidentally, today is her birthday also. Best wishes. And all the faculties of Department of Physiology, all the assistant professors of various departments, postgraduates, my dear students. First of all, I have to talk about HOD Physiology, who is continuously working on the CME, and she started it for 6 months back itself. And when she joined last year, she immediately organized the HYGEA 2024. Then only I knew there is an association for physiology. So actively running. Now, having told Madam is an important aspect and important instrument in getting the members to the Physiology Association nationwide, it is a great effort. Congratulations to you. And apart from HOD of Physiology, she is the president of National Physiologists Association. And it is a privilege for us to have the national president. And regarding the students, see, constant encouragement by the faculties will definitely relieve the stress of the students, whatever stress they have, and coordination with the academic activities. For example, maybe a month back, we received a ragging complaint on Friday. Then Saturday morning, that was the second Saturday, I went to Jen's hostel, UG MBBS hostel. I was sitting outside the hostel and asked for anyone inside because all of them would have gone for 2 days leave. Then to me, there appeared only students from other states and our states also, some few students. Santosh was there. And we had 7 or 8 other states, especially from the north. Just I was asking what was the breakfast. They said dosa. So I asked the students other than Tamil Nadu. They said no. What about grandparents? They said no. I asked whether they are tested and you are telling no, or you are just telling without knowing whether they are really don't have the disease. They said parents and grandparents, we are sure that they don't have comorbids. Then I told Santosh, just to make an observation from the whole MBBS students, from the students from other states where the rice is not the main dietary component, whether prevalence of comorbidity, diabetes and hypertension is there. Just make an observation and tell me on Monday, I said. I got from him 4 papers he wrote. No one knows here. He came Monday evening or Tuesday evening. He gave me this with each student, a family tree, and there about no comorbids. So I told them, you take up this study. See, diet plays a very important role in comorbids. We all know that. But of late, stress causing or a precursor or a worsening agent for all the prevailing diseases, and more so for cancer also. So long we were thinking stress is a psychological disorder. That's it. The stress comes from various aspects: professional, personal, environmental, or academic. So even the children have stress. A LKG student can have stress. Our own parents sitting at home can have stress. They are bothered how to go to a toilet in the night hours. That itself is a stress without a help. So stress is in various form around us, involving us, injuring us, and maybe it is a chronic one, or an intermittent one, or a temporary one, or a permanent one, or a perennial one. This is the understanding I went through my own mind yesterday. So if at all stress I have, it is not produced by me, but it is usually caused by others. I feel the personal things or professional stresses we come across, maybe it is caused by others. That is, environment can cause that. It may stay back, or it may stop, or it may continue. So stress is always there. So it is the individual who has to manage that stress. So various forms of stress, various modes of stress can attack an individual. The individual is the sufferer. The individual has to manage. If he doesn't manage, it leads on to a disease, a psychological diagnosed, very prominent disease. It becomes a stress. It's a stress disorder, or a stress indirectly causes many other diseases. So instead of treating the diseases, we have to prevent stress as well as control stress as well as manage stress. That's what the understanding I had yesterday night. So hope I am correct in that. And when as a surgeon, I used to ask my students, what is dyspepsia? Can anyone say what is dyspepsia? I'll ask. That is my favorite question. Anyone can describe what is dyspepsia? Physiologist? Students? So it is not a single symptom. It is a conglomeration or a combination of symptoms. So all of us would have experienced dyspepsia, but we are not unable to define it. So it is not a definition, it is not a disease, but it is a group of symptoms. A flatulence can be a dyspepsia. I can say a discomfort, upper abdominal discomfort is also a dyspepsia. A heartburn is also a dyspepsia. Indigestion is also a dyspepsia. Flatulence, abdominal bloating, heartburn, abdominal pain, upper abdominal pain, nausea, all put together may be dyspepsia, or one or the other may be dyspeptic. So dyspepsia is a group of symptoms. But coming to here, stress, it is neither a symptom, but it can lead to a disease because of some causatives. For example, under a LKG student getting up early to go to school itself is stress. So on Saturday, Sundays, we see them happily. On a holiday, they get up early. But on a school day, working day, they get up late because some stress they feel it is in the school. So environment is playing very, very important role in causing stress to each individual. So we cannot prevent stress, but we can accommodate, we can manage, and the topics chosen by you are very, very great. And Department of Physiology has a yoga class within them. And even I used to tell Professor Muthuselvi, I will come for a yoga class because we have to manage our own stress. No one else can manage for our stress. So recently I saw a movie, there a grandma says to a friend of a hero, who says that the hero is become worse and he is addicted, he is doing all these things. The grandma is well educated. She says, he has taken that, let him suffer. This is the statement given by the grandma. So whether we are going to suffer, whether we are going to manage, the management is the best option. And before going to a stage of disease, we have to curtail, and we have to tune up our mind and body to accommodate to all the kind of stress. What is a stress for one individual may not be a stress for another one. What is very simply we look at may be seriously looked at by someone and taking very bad decisions or worse decisions, even causing death. So I think this is a very appropriate time when all of us are living in this world of stress. Let us manage stress, prevent diseases. And I am very, very thankful, grateful to the head of department for organizing this program and bringing a very young guest of honor. Even though she is biologically old, she is very, very, very young to me. The few words she was telling, few conversations we were making, it is so encouraging and sportive. Thank you, madam. And I thank all the faculties for coming here and to talk on their own subjects related to stress. Let us live a stress-free life. Thank you very much.
Thank you so much for your valuable words, ma'am. Now I kindly request our HOD ma'am to felicitate our Dean ma'am. It's a pleasure to have with us Dr. Tamilkodi ma'am, Senior Physiologist in Tamil Nadu, retired Dean and Professor, Kanyakumari Medical College, a dedicated, dynamic person, unwavering in her contribution to the field of physiology as a teacher. I kindly request Dr. Tamilkodi ma'am to address the gathering.
மேம் உட்காந்துட்டே பேசுகிறீங்களா? நான் ஒரு வார்த்தை கேட்டேன், இந்த நான் நிற்க தான் வேணும், உட்கார வயசாப்பில் எதுன்னு கேட்குறாங்க என்ன. as a great example, never ever say that I'm not able to.
Very interesting, isn't it? விவேகானந்தர் சொன்னார், brothers and sisters. நான் சொல்கிறேன், good morning children and grandchildren, right? Now the topic of the day is stress physiology, right? Very interesting topic. Every one of you should remember this day when you are going to be rid of stress. Very interesting, isn't it? How to be rid of stress. Morning, Priscilla, madam was talking on stress. The stressors, the stress, the various types, how it affects our body, what are the things responsible and what are the effects, right? Did you all listen? Yes, I could follow that you have been following, right? Now, having known that, I differ from Dean Madam. The stress is preventable. You know how? Once you are very much determined, psychiatrist, I am not going to be affected by the stress in an adverse manner. That is very important. Madam was telling about eustress. That means the stress is required. That also one of your colleagues was telling. It is advantageous. Good. Isn't it? That means the stress, unless there is stress, we cannot survive. You and I cannot survive. The gynecologist, obstetrician will remember the moment the baby is coming out of the uterus, which is a very peaceful environment, that moment itself is a stress. Am I right? Yes. The hormones are responsible for that coming out. So from that moment, the stress starts. But that doesn't mean it is detrimental. You and I am now 78. I am able to survive in a very good way, very comfortable, in spite of so much of stress we have undergone in our lives. So that means the stress is not bad. How we are going to face it and manage it, that is very important, right? I used to tell my children, grandchildren, you have a valley. Nothing can disturb me, emotional or physical, right? If you come across any new person, you undergo stress, because we don't know about the person. But if you are confident enough, you will be able to say, yes, good morning, how are you? Any unknown person. When you say these words, even if it is the worst person on earth, they will be surprised. What? This person is not afraid of me. So confident, so peaceful. So that means they will be taken aback. They will lose their balance. At that moment, you can gain. Yes, what is it you want? Like that. So you must know how to combat stress so that you will be in a very steady manner. And I'm so confident about it because all of you are doctors, and we doctors, we know what is physiology of the body, individual, right? We know the structure, functions, and what are the likely alterations in our body. So when you students study, you study in that attitude. What is life? How the life processes are going on, how our body is altered, or normal functioning and altered functions. Then you are more confident, right? Am I right or not? Once you know, now, not much of details about the stress and stressors. Now, 50% of your thoughts must be, yes, why should I get strained? That should be the thing. No, கொஞ்சம் பேர் பேசுவாங்க இப்போ அதெல்லாம் கேட்டிங்கனாக்க then you must have a feel, oh, so far I have been under stress. Hereafter I will not be under stress. You will not use that term because you are prepared. See, the prepared individual you'll be able to face any sort of difficulties. See, as a dean, as a director, as a dean mostly, as Madam put it, we will be under so many problems, daily, momentary, but still, when you are confident, you know how to handle, how to face the people. Because very simple. You will really wonder if I tell you, dean of a new medical college, I have worked for 22 hours a day for 1 year and 9 months to establish the government medical college at Asaripallam. We started with 300 people working, and now 200,000 people are working, right? And the coordination, the work of a dean, first of all, wherever you are, you must understand what is it I am up to, whether it is a student or a staff, anybody. What is it I am expected to do in this particular position? That you must be very confident, curious to know and learn. So for that you must listen, learn. Right? 2L. Listen, learn. Then follow. Then it will be easy. So the combating stress is not difficult. Stress management is not difficult, provided you know how to face it. Right? அதுக்கு ரெண்டு ரொம்ப முக்கியமான பாயிண்ட்மா. Love yourself. That is very important. You must know how to love yourself. What for? Because the purpose of life is to love each other and to help each other. Apart from nothing else. Why should you choose medicine? Either to earn money or to get fame or to serve others so that I'll be satisfied. I have helped so many people. Right? That is the purpose. So you must know I am important. See, that's why Madam was telling, I am 78 years young, not old. See, when I know, you will be very surprised. When I thought of my age, when one of my classmates was very this thing. I said, what, Kasima, you are like this? Yeah, எனக்கு ஒன்ன மாதிரி தான் வயசாகுது. அப்படின்னா அவள் ஓல்டிஷாக இருக்கா, டயர்ட் அவுட்டு, அப்படி நடக்க முடியல, கஷ்டமாக இருக்குது, பேச முடியல, எல்லாம். நானும் சாதாரணமாக இப்படி ஓடிக்கிட்டு நடந்துட்டுருக்கேன் உங்கள் மேடம் மாதிரி. உங்கள் மேடம் ஓடுறாங்களா, இப்போ பிரசிலா மேடம் எப்படி ஓடிட்டுருக்காங்க, அது மாதிரி நான் ஓடிட்டுருக்கேன். அதே ஏஜில் என் கிளாஸ்மேட்டு இப்படி வரா. என்னாச்சு அப்படின்னா, எப்படி நீ இப்படி இருக்க அப்படின்னு கேட்குறாங்க. நான் சொன்னேன், ஐ ஆம் வித் த யங் பீப்புள், யூ ஆர் வித் த பேஷண்ட்ஸ். So the young people should feel I am young, right? So the young people are endowed with much energy. That energy must be properly guided and utilized. So never feel hurt, never feel worried, never be in a hurry. The things are there in this world. If you believe in God, God. Otherwise, nature has given you bountiful in this world. One simple example, such a huge building, and we are talking with each other. It's very simple. It isn't. Yes, you are all gifted. When I first saw such a lecture hall, I wondered. Because till then we have not exposed to that. Now that you are very much used to this, you must feel first elated and happy. See, the happiness is very important. Every one of us is after happiness. But all of you must remember the happiness is within us. It cannot come from outside. You must always remember that. One example I tell you, when I was a house surgeon, I had an assistant surgeon. He was very tall, was a surgeon. When we were going for rounds, he was just asking me, what, ma, when will a man be satisfied? I couldn't follow. I was just 18, 20 years. I looked at his face. Sir, I am a very bold person, to be very honest with you. Sir, I said, when will a man be happy? That was the question. When will a man be happy? Then again I said, I'm sorry, sir. I couldn't follow you. Then he stopped. When will a man be happy? Then I said, I'm sorry, sir. The person that, then he gave a clue. That is 2,000 rupees, 200 rupees, 2,000 rupees, 2 lakhs rupees. When will a man be happy? That was the question. I understood. Then what was the answer, you know? I said, sir, it is not the money, it is the man who is going to be happy about. It is not the question of money. His response was like, எனக்கு அவரை ஆச்சரியம், என்னதுக்கு இவ்வளோ ஆச்சரியமாக பார்க்குறாரு அப்படின்னா, how do you know? How will you know? சார், 4ஆம் கிளாஸில் நான் ஒரு கதை படித்தேன் சார். 4ஆம் கிளாஸில் நான் கதை படித்தேன். நாங்கள் பேசுகிறது 4th year மெடிக்கல் MBBS, ரைட்? 4ஆம் கிளாஸில் ஒரு கதை படித்தேன் சார். அதனால தான். என்ன கதை? ஒரு புவர் மேன் அண்ட் புவர் மேன் வில் பி இன் அ ஸ்ட்ரீட், தட் கிங் and his minister will be going on rounds to find out who are all happy, whether his rule is quite happily received. Nobody is happy. Both of them will be going house to house. Nobody was happy. Some complained, something. Then this king was very unhappy. என்ன நம்ம எல்லாம் நல்லா செய்கிறோன்னு நினைக்கிறோம், அந்த மக்கள்லாம் இப்படி இருக்காங்களேன்ட்டு. அப்போது when they cross a forest, like ஒரு பர்சன் வில் பி ரொம்ப டான்ஸிங். இப்போ நம்ம டான்ஸ் பார்த்தோம், அது மாதிரி டான்ஸு ஜாலியாக. அவன் கையில் ஒன்றும் இல்லை, அவன் ட்ரெஸ்ஸும் சாதாரணமாக இருக்குது. அப்போ த கிங் வாஸ் சர்ப்ரைஸ். ஏய் மினிஸ்டர் வாவா, இவன் என்ன இவ்வளோ சந்தோஷமாக இருக்கான், இப்போ என்னன்னு கேளு. அப்போ நீங்கள் இந்த கதை படிச்சிருக்கீங்களா யாரானா? ஞாபகம் இருக்கா? இல்லை, அதனால தான் தெரியல. உடனே ஏப்பா எப்படி நீ சந்தோஷமாக இருக்க, உங்ககிட்ட என்ன இருக்குது? என்கிட்ட ஒன்றும் இல்லையே, நான் சந்தோஷமாக இருக்கேன் அப்படின்னா. சாப்பாட்டுக்கு என்ன செய்வேன்? அப்படியே போவேன், எங்கேயாவது என்ன மாதிரி கிடைச்சா சாப்பிடுவேன், இல்லாட்டி நான் வாட்ட படுத்து தூங்கிடுவேன். த கிங் வாஸ் சர்ப்ரைஸ்ட். அட, நம்ம ராஜ்யத்தில் ஒருத்தர் இவ்வளோ சந்தோஷமாக இருக்கானா அப்படின்னு சொல்லிட்டு மந்திரிகிட்ட சொல்லி ஒரு பண முடிப்பு கொடுப்பான், இன் அப்ரிஷியேஷன். ஒரு தெரியல உங்களுக்கு, பொன் முடிப்புன்னு சொல்லுவாங்க அந்த காலத்தில். கொஞ்சம் கோல்டு காயின்ஸ் போட்டு முடிப்பு அவன்கிட்ட கொடுத்து, இந்த மினிஸ்டர்கிட்ட கொடுத்து கொடு ஐயப்பாவா அப்படின்னு சொல்லிட்டு, அவன் மினிஸ்டர் என்ன சொல்லுவான், இதை வச்சு நல்லா படிச்சுக்கோ, ஏதாவது ஒரு பிஸ்னஸ் பண்ணி என்ன மாதிரி செஞ்சு படிச்சுக்கோ அப்படின்னு சொல்லிட்டு வாங்கி வச்சுக்கிடுவான். ஒரு 1 month கழித்து திருப்பி ரவுண்ட்ஸ் போகிறப்போ த வெரி சேம் ஃபெல்லோ வில் பி லைக் திஸ். ரொம்ப சோகமாக அந்த மரத்தடியில் உட்காந்துருப்பான். உடனே கிங்குக்கு ஒரே ஆச்சரியமாக இருக்குது, என்னடா நம்ம என்னமோ கொடுத்துட்டு போனோமே, ஒரு பயலுக்கு ஒன்றும் தெரியல என்னடா. அப்போ மினிஸ்டர் போய் கேட்பான், என்ன ஆச்சுன்னு. ஏய், நீங்கள் தான் அன்றைக்கி வந்து என்கிட்ட காசு கொடுத்தீங்க இல்லை, இரு சொல்லிட்டு கொடுக்குன்னு ஓடி போய் அந்த மரத்தடியில் அந்த பொன் முடிச்ச தூக்கிட்டு இருந்தேன் என் கையில் கொடுப்பான். நீ இந்த முடிச்ச நீயே வச்சுக்கோ,